this facility, my muscles were so deteriorated that I could not even sit up in bed. I could do nothing. But since I've been working on the Nautilus machines, I can now walk without assistance up to 350 feet. When I come off that machine, and I've increased my press weight 7 or 8 pounds in one day, it gives me a lot of self-confidence.
And it's Clara?
Yes, Clara.
Hi, Clara. Pleasure. I'm doing great. How are you doing?
Fine, thank you.
Now, I have an interesting question. Here you are sitting in a Nautilus low back machine, and you're in a nursing home. How is this machine supposed to help you? And is it helping you?
It's helping me tremendously. I'm a person who's had 15 major surgeries. I'm off of a surgery 4 weeks old. My right side was totally collapsed. My muscles were collapsed after my second stroke in June. They did an Achilles tendon surgery to lengthen my leg so that I may learn to walk. I'm on these machines to learn to use my arms again and to rebuild my muscles. In 4 weeks, I have progressed tremendously. Just 4 weeks.
Now, is that you're getting stronger, or you're able to do more things?
I can do more things, and I'm much stronger.
That's just absolutely great news. Now, here you're the therapist, so you're working with this patient. Have you always used equipment like this?
No, actually, I've been using a manual resistance before we received this machine. So then I was only able to apply 30 pounds of resistance, or manual resistance, in trunk extension. Now, having had this machine, we're able to give more resistance to up to 60 to 200 pounds. So this has increased her trunk strength tremendously, improved her posture, and improved her gait.
I noticed with this patient, she's not all the way forward, that you've used the range control device to limit her flexion.
Right.
Now, does that help you working with this patient, that it lets you have that range control?
Exactly. With this range control, it can allow me to adjust the machine to the patient's comfort. So she could start from 0 to 100 or 30 to 100 at that range.
Now, I also noticed something about the machine. It seems to position the patient in a way that their lumbar area is supported, so there's postural support.
Yes.
If you were working on, say, a mat table trying to provide manual resistance, would you have to hold that with your hand to keep it still, or would someone have to help you, or how would you do it?
Well, actually, I won't be able to do that. With this machine, with all the support, the patient is able to perform the exercises safely.
Very interesting. So the machine provides range control, postural support, and resistance control.
Correct.
Automatically,
yes,
and objectively,
yes,
and that makes what you're trying to do easier.
Correct.
So the patient gets better results.
Yes.
That's awesome. Ryan, you're a physical therapist and a bodybuilder. How does this equipment fit into the way you think about helping people get stronger?
Well, actually, this has been in my mind ever since I started physical therapy, which was a long time after I started weight training. I started weight training when I was just 11 years old. And over the years, I learned about all the benefits and everything that goes on as far as the physiology of the musculoskeletal system to get optimal results. And then when I started doing my therapy, I was always in the back of my mind, gosh, I wish I could incorporate what I knew about bodybuilding and how the musculoskeletal system responds optimally to resistance training. How could I incorporate that into what I was doing with my patients? And there was just no means for me to do it effectively. I mean, I could provide manual resistance, but only up to a certain point, and then things would just start to break down, like the friction between the patient and the table wouldn't be enough, and they would just slide in order for me to provide enough resistance, so I just couldn't get it done. And with this equipment, I can really do the kind of therapy I've always kind of wanted to do with a lot of my residents.
So what I hear you saying is that the range control, the postural support and the resistance control that are automatically and objectively provided by the equipment helps you accomplish your therapy goals?
Yeah, exactly. Go ahead and push. How's that? There you go. I think you found your way. And come back slowly, okay? You want to control the comeback. That's good. Excellent. Push again. You okay? All right. Go ahead. Yeah, you're kind of tight back here. That's why your legs aren't shaking now. That's okay. You're doing fine. And push real hard. Go ahead. 2 more times, okay? We'll just give it 2 more times. Out of way, Ken. Come back slowly. Good. And one last time. Give it what you got now. There you go. Terrific. And come back and rest. Good. You okay? Are you comfortable with your legs up? Are you comfortable with your legs up? Okay.
How much resistance were you using just now?
Let's see. We have it on 2 plates here. It was about 36 pounds.
So this patient weighs approximately...
Hey, what do you weigh?
155.
155. Uh-huh.
So if he weighs 155, you're going to have to progress that resistance almost 500%?
Yeah.
You expect this patient to get 500% stronger?
Yeah.
That's a huge increase in strength. Is that something that you could always plan when you were working with patients, or does it have anything to do with does the equipment let you, how does the equipment play into that?
Could I plan 500%? I don't think I ever thought of it in those terms, you know. It's more of like, well, can they do it, can they not do it? But getting there, you know, incrementally in an organized fashion is kind of difficult.
So a 500% increase in strength. Now, I understand you're going to the stair training next. As this patient gets stronger, closer to that 150 pounds, will the increased strength improve the patient's ability to participate in that part of the therapy program?
It should. I mean, we're just relating the hip extension and knee extension, you know, taking it up the stairs. It should help.
I understand that Professor Romagnoli is doing the leg press and the lower back machine. Now, the increased strength from those particular exercises, how does that help with the functional therapy you're doing at this time?
You know, we're trying to gain strength so he can have better trunk control for his sitting and for his walking activities. He was having a really, we're doing like manual resistance, things like that, but it's very hard to gauge if he's gaining strength that way. It's just very subjective on my part. At least when we're using the machines, we can objectively tell whether he's getting stronger or not. And there seems to be a positive effect. He can stand straighter, longer, walk further now.
The machine is especially helpful to me because my arm hurts terribly. The infection first came into the elbow, and to try to support myself in a walker is really painful.
So as your legs and back have got stronger, it's taken the pressure off your arm because now your legs and back are holding you up better.
Also, in the machine, there is no pressure on my arm. Great
point. Now, I have a question. The therapist tells me that this is helping, but now for you, in the activities that you need to accomplish each day, trying to stand, trying to get to the bathroom and get back, has the increased strength helped you in a way that you've noticed?
Yes, it has. When for the first 3 months after surgery, I couldn't even shuffle my feet. You know, I was totally paralyzed from that point of view. And now, you know, I definitely can notice the difference. It's very slow with me because the nerves have been damaged, but it is a positive improvement.